so old now. Yeah. So again, the heart is not in the left side of thoracic. They are right in the middle, but the bottom part, the apex part, they are leaning toward left, right? Now, the apex itself, when we auscultate to listen to the heart rate, that's what called apical pulse. There's no way by palpation, by feeling, all right? Now, what is the anatomical position? Where is that at? Anybody can tell me. So if you're looking from outside, you're looking at the chest, right? And we have that clavicle there, right? Clavicle there. And we have the sternum, right? Okay. And then we have costa, right? It has to be bigger than this. It's not proportionate, yeah, because the heart itself is so big. It's kind of like giant heart, supposedly as big as fist. Now, anybody can tell me what is the anatomical position of the apex? So we get an idea, where is that exactly located? First of all, in a top, okay. First of all, what intercostal is this apex? In what intercostal? So rib. Yes, costa is rib, right? Costo is rib. Let me get another picture of costo, yeah. So to give an idea, even though you don't have to dissect someone's chest, you get an idea where is the location of the heart, yeah. So when you are a PA, some of you would like to go to PA, higher education, you know where to position that stethoscope, yeah. And in fact, that's also a good place to listen for S1 of the heart sound, yeah. So we're going to clear this first, yeah. So let's see this area here. Oh, awesome. I love that when we can, yeah. Okay. Maybe pinky, yeah. So this is the sternum, right? What is this again? We did talk about yesterday. Put it in the chat. This is the body, corpus of the sternum, manubrium. And what is this? Start with X. Yes, xiphoid process. Good job. Good job. Now you see that here. This is, you see that one costa here to the second costa. This is what we call intercostal one or first intercostal. Yeah. Second intercostal, third, fourth, and fifth. Yeah. And then we see here clavicle, left clavicle, right? This is left clavicle. What is this area we did talk about when we talk about skeletal? Anybody still remember? What's that? Type it. The meeting of the lateral, most lateral part of the clavicle meeting with the superior anterior part of the scapula, right? Right out of the supraacromion. Good job. Yeah, awesome, awesome. Now you see that here, 1, 2, 3, 4, 5, right? And right at the fifth intercostal, and then right midline. Yeah. Oh, I need to make like this. We take a left midline. So you see that You see that half and half. So basically half, yeah, midline. Okay. So this is what left midline. So left midline. Oh, left clavicle midline at, so right at here, yeah, that's your apex at fifth intercostal, yeah, intercostal, inter means between, costo is rib, el is pertaining to, yeah. Okay, so that's where the apex goes. So we can imagine the heart, yeah, the heart is probably somewhere here, yeah. With a sternum, we do 1/3 CPR, press that. Okay, that sounds right. So it's kind of like that. Let me change the color. It's kind of like that, yeah, the heart, kind of like that. So you can say, because this is the apex, so this is the anatomical position, yeah, of apex. It is so important in clinical application, yeah. So where is that anatomical position? Left mid-clavicle line at fifth intercostal. Now, what if the patient is not skinny? Anybody skinny here? When you're skinny, you can see your ribs, right? And the muscle part, when you eat the barbecue ribs, that's the meat part that you eat. So that's the meat part, that intercostal. Anybody skinny? When you're skinny, you can look at the mirror. You probably can see your intercostal. Now, what if you cannot see even patient's costal? What are you using? So the apex, the left clavicle midline, this is right below, the left nipple, yeah? Or just say right below the nipple. Maybe we should choose different color. Right below the nipple, yeah? Now for the guy, it's easy to see their nipple and right below, right? Because they don't have mountain in there. It's just a flat surface, okay? Now for the woman, it's really hard. There is a mountain of fat, right? So when you have to either to listen with the stethoscope, or when you put that EKG lead, yeah, for your V1, V2, V4 precordial lead, then you have to do as much as you can at the foot area of the mountain. Yeah, so like this is the mountain, this is the nipple. You cannot really put stethoscope with the thickness of the breast, the mountain. So it's just like the foothill of the mountain. Yeah. So now you can imagine, right? So this is me. I can imagine that my heart is kind of like as big as a fist. It's kind of here and then toward here. So you can imagine, you can now imagine, but don't stare too long. Eric, I know you want to become a PA and you have a woman patient. Just look in 1 second, okay? Especially when your wife or girlfriend knows that you're in trouble. You're going to be in dog's house. Do you guys know what dog's house is? All right, Eric. So now we understand only one. Yeah, exactly. As a doctor providers, you need to know that. Yeah, especially a woman. You don't want to get sued, even though you have your MA together with you there. You don't want to get and then look at for so long. No, don't. Okay. I never ever suggest for that. Now, even women too. Yeah, Carmen, I know you laugh at Eric, but you too, even Carmen too, a woman, we're not comfortable if you keep looking at our breast. Anybody, even a woman, right? So you just have 1 second and you imagine and you know where to put the stethoscope. You know where's the apical. Yeah, without even looking at the nipple, you just imagine right the midline of the mountain and then the foothill. You got it. For the guy, sometimes guy has a little bit big boobs too when they take so much corticosteroid. Yeah, anybody knows what's that called when the a guy have big boobs? I will learn that later. So sorry, I kind of wandering around many times, so I hope I don't confuse you. Yeah, focus, Miss Skylar. Okay, I will. Okay. All right, we'll go back. Yeah. Okay. Where's our picture? There you go. Now you get an idea how big it is. Where's that located? And even when you look at someone's chest, you have that imagination where exactly they are located, especially the apex. All right, are we good? Eric, is there any chat here? Ha 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 ha. Yeah, exactly. Ha ha. I'm glad you guys laugh. It's Eric, Sylvia, Christian, Isabel, Simin, the other iPhone. You guys don't laugh. I hope you guys mentally okay. Yeah. Why is it important to laugh once a while? Anybody can tell me. Ha ha ha. Okay. You guys quite normal. Good to know. Now, why is it important to laugh once a while? Anybody knows? Especially with this COVID, with restriction of socialization, social life, right? Eric, oh, I'm sorry, Eric, you don't laugh. Maybe you have a lot of problem, huh? You're not able to take picture. Eric, are you laughing? That's fine. It's your, um, oh, you do. Okay, good to know. Laughter is it's good for your mental health. Exactly. Relieve tension, stress. Exactly. Better to laugh than to cry. But what happens if you laugh a lot too? They're gonna send you to the mental institution too because it's loose, right? Laugh lines. Yeah. And it stimulates a hormone of endorphin hormone. Yeah. So if you're too serious, you internalize problems so much, don't let it go. Maybe now is the time to change it, right? There's people that internalize so much of problem that unchangeable. Don't let it go. Having difficulty to laugh, yeah. So it needs practice, and it stimulates hormone of what? What hormone we stimulate when we laugh? They said eat chili, laughter. Anybody knows what hormone is that? Part of the hormone of happiness that everybody wants. Yeah, when you breastfeeding too, Sylvia, I know you have little baby. As much as you can breastfeed your baby. Yeah, that gives you oxytocin. Not quiet. Yeah, serotonin is more on the brain when we take all the medication, the drugs. Yeah, endorphin. Okay, so that's quite similar like serotonin. Yeah, that's a hormone of happiness. So basically, we don't need drugs. Yeah, we don't exactly. We don't need amphetamine. Yeah, we have that naturally can be released by not internalizing problems so much. Let it go. Yeah, I used to be so stressed, depressed. The first time I immigrated to this country, I was a doctor. I never had any debts. I had my own house. I never have a financial challenge in my life. But once I came this country, I could not find any job. I did not have any licensing certification, US based. Um, I was so financially poor. Yeah. And then when we are financially poor, that's easily goes like domino effects, goes to the mental things. So I had that 5 years darkness of mental problem that I was depressed. Yeah. Because it's shocking for me of having that reality. Okay. Even there's a point that we pick up food out of the trash that they throw nicely when it's expired. Now we're so thankful with the blessing of the work of our hands. We're working, my husband do business, and we also do rental property business, which is a good way of growing money, not just making money, but growing it. Yeah. So anyway, it's a little bit off topic, but I hope that can help my students to be a complete person. Yeah, complete person, not just physically look pretty and handsome, but we have all kind of dimensionality in our life, our social life, mental life, right? So I'm glad that you guys laugh. Kristen, did you happen to laugh a little bit? Yeah, I know, Kristen. Oh, okay, good to know. Yahoo, yoo. Eric, yes, Sylvia, Simin. Did you happen to laugh, Simin? If you don't laugh something funny, maybe, but not laugh too much too. Yeah, remember homeostasis. Anything excessive or lack of, those are sickness. Oh, focus. Okay, focus. Now heart. Ah, all right, all right, all right. Now, first of all, heart. What is the main function of heart? Go ahead, put in the chat. Just one word. Start with P as Paul. Yeah. Imagine like a swimming pool. Yeah, we need to flow that clean water and then get that dirty water and filter it and then flow it back. Pump. Exactly. Yeah. So the idea of our heart is to get that dirty, or we can deoxygenated blood. Yeah, pour oxygen blood into the right side of the heart. Yeah, so the right side of the heart consists of deoxygenated blood. Yeah, just like a swimming pool pump. There's a area for the dirty water after we swim on that, right? And then they release that into the filter. Filter is the lungs. Yeah, so we have they work together, lungs and the heart, right? Especially through this pulmonary artery. So the right side of the heart is deoxygenated blood, and the left side of the heart is oxygenated blood. Yeah. So many times, if you see that the figure, the graphic that you see in textbook, all right, it shows that oxygenated blood symbol with the red color and blue purplish color symbol of deoxygenated blood. Now we just talk about right side and left side of the heart, right? So we know that we cannot mix this oxygen poor blood and oxygen rich blood. Is that making sense? So whoever creates our heart plan this and create this structure wonderfully, perfectly. Yeah. Said, oh, okay. We put that dirty blood here, and then we're going to push that, eject that into the lungs, and then there's a gas exchange there. And once oxygen rich, we move that to the left side. So there should be any thick wall in between. Anybody can tell me what is that? Which is over here. What is this called? Oh, wait. No, not really, guys. That's here, but also imagine three-dimensional all the way here. Yeah, all the way. Basically, it's good. Yeah, the heart cut half. This is your heart cut half. Yeah. What is that called? Start with the letter S. We can play hangman if you don't get the word yet. Yay, Carmen, septum. Carmen, seems like you don't need to take this class. Do you want to give lecture now and I just watch? But I keep 100% the salary, the payment from the LACCD. All right, are we good? Awesome. We got that now. So we have septum. Now, sometimes there's a baby, right? Born with defect in their septum. There's a septal defects disease. Anybody can tell me what is that and where is that located? It happened to the baby, and then what happened? The poor oxygen blood and the rich oxygen blood get mixed. That's what we call baby blue syndrome. Long time ago, but thank God to the John Hopkins, yeah, with one of the assistant that did not go to the medical school, but he was helping the professor to find out the first time ever the theory of baby blue, because back then, I think in 1950, when there's still segregation, yeah, so the guy, smart guy, is a black guy, and he was segregated, but he's so smart he didn't get any opportunity. He's helping that professor. There's a movie about that if you guys want to watch. It's really awesome. So what is that called? The septal defects disorder, or not really disease. What's the movie? Ah, I will find out the name of the movie. Something related about John Hopkins. It's really awesome movie. I forget already. Yeah, you probably can. It was long time ago when I watched, maybe 10 years ago. It's quite old movie. All right, anybody, come on. What would be that? I can give you the acronym. What does it stand for, guys? Anybody? Carmen said, that's the one. I knew that. I was about to say it, but my mouth just get locked. So what does it stand for? You already get two word there, septal defect. Yeah. Yes, Carmen. So when the hole located in this ventricle here, yeah, ventricle area, if located anywhere in here, yeah, anywhere, and then they make a hole, that's ventricle. Yeah, exactly. Yeah, ventricular septal defect. What about if they are located, it's kind of behind this pulmonary artery over there, yeah, between, what if it's located over there, yeah, between atria, what do we call? Atrial septal defect, yeah. Now, people with the tetralogy follow, people with the baby blue, sometimes combination. Sometimes they can close up as they grow, because we know embryology, the last two, basically the last one is the lungs that will grow mature, right? And then another one is heart also. Sometimes we have that in the kid, and but they can sometimes naturally can be, if it's not so severe, but otherwise need to go through operation. Are we good so far? So we're done with septum. Yeah. Any questions? No questions? No? All right. Now, we know right now with the COVID, it's a house booming, right? Everybody want to buy 2 bedrooms, 3 bedrooms, 4 bedrooms. Now, if we imagine the heart is like a house, how many bedrooms how many chambers, bedrooms, house? Because there's door in between. How many chambers? Maybe I should say that. How many chambers? 4. Good job. Now, there is a verse there saying, so what is this? This is one of the 4 chambers. What is that? What is that chambers? Go ahead, put that in the chat. Exactly, Sylvia. Good job. Left atrium. Good job. Ding, 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 ding. Yeah, you got it. Okay. Now, what is this chamber here? I just want to make sure what they meant, all of these two. Yeah, that could be. All right, what is that chamber? Right atrium. Yeah, the top part is atria. Okay. The bottom part is ventricle. Yeah. So this one is, so right, or we can put like right. Never mind. Maybe no. So guys, it's really hard to change my handwriting. So I hope you can read that. Yeah, left atrium. We're gonna make it skinny because otherwise we're gonna put a lot of stuff here. Yeah. Wait, why did I say left over there? Are you okay, Miss Kyler? I'm good so far. So right atrium, yeah. And this one is left atrium. Are we good? Yeah. Still easy peasy, making cheesy lemon squeezy class, right? All right, good, good, good. Now, what about the other 2 chambers, right? So I don't know which one they meant with the basically the whole thing of this, yeah? All of this is, what is that? I think this is what they aim, right? Yeah. What is this? That's in the right side, yeah. So anatomical position always like this, right? And this is my left, this is my right. Even though from you, you see this, my left as a right, but you need to count as you are me. Yeah, that's how you do anatomical position. So what is this? Good job, Sylvia. Right ventricle. Now we have another one here also. Yeah, all of this. What is that? What is that aiming? They aiming to? This one, right? Yeah. Of course, this is left ventricle. Yeah. Are we good? All right. So now between left atrium to left ventricle, there is a valve. There is a door. Yeah. So between this to this, there is a valve over there. What's the name of the valve? And the valve is kind of double. Have you guys ever gone to the Cowboy Saloon bar to go drink over there? Or at least imagine, or at least watch a movie. And when they go in, the door's gonna open like this. Yeah. it's like a flap. So the valve like that, because two of them we call bi, right? And the valve, the flap is called cuspid. Yeah. So we call bicuspid valve. Are we good? So we call bicuspid because two valve. Now this one, if you see that there are three of them, so I don't know how to do that, but when you open like this, there's three of them. Yeah. How do I? Yeah. So say three like this. Yeah. And then when they're open, three of them. So between right ventricle. So which is this? Between right ventricle and left ventricle, which is this one, we have tricuspid valve. Yeah. Are we good? The way you memorize that, if you see the letter right, there are 5 letters, more letters. So the valve is more letters too. And then there's a letter T. Oh, there's T also there. Never mind. I'm trying to help mnemonic. But tricuspid, right? So you can imagine sometimes people get confused which one bicuspid, which one is tricuspid. Yeah. The word left is only 4 letters. So the bicuspid is left less letters too. Maybe that's one way, but you can make your own way, because like it or not, you must remember this for the rest of your life. Yeah. Try right. Carmen, I got a good job. Yes, try right. I think I heard that. Good job. Awesome. Smart, Carmen. Now, what's the other name of bicuspid valve? What's the other name? Start with the letter M. 6 letters. Mitral, somebody said that? Oh, someone else. Dang, what did I tell? Never mind, I already said that mitral valve, yeah? Oh my goodness. Teacher, are you okay? Yeah, I'm okay. All right, so we already have 2 valves, 2 doors. So 4 bedroom house with 4 doors, right? Any rooms have doors. So we have tricuspid valve, bicuspid valve. Now we also have another valve here. If you see that this is another valve, can you see what I'm aiming? Yeah. Let's see with different color. Yeah. You see that there's a valve here. Now what is this? So this valve is between, what is this again, guys? Right ventricle. And what is this that go to the lungs? So this is go to the left, yeah, and this is go to the right. So what valve is this called? Yeah, so this is pulmonary. Oh, we're gonna say that here. So this is pulmonary. Maybe have to be here. This is pulmonary artery. Yeah. So this is, and then they branches left pulmonary artery. Are we good? And this left pulmonary artery will go to the lungs. Yeah, to the left lungs. Left lung. Why? What's their mission? Why do they want to go to lung? What happened? Oh, they are carrying poor oxygen blood. They have a wonderful mission, go to the lungs and then release that carbon dioxide in the alveoli, like millions of them, and then grab the oxygen. So there is a triangle love affair happening there, yeah, between oxygen, carbon dioxide, and blood, which is hemoglobin. Yeah, hemoglobin who bind that and then flow in the blood flow. And remember, we did talk yesterday about if there's an obstruction of the blood flow into the cells or tissue, right? They start become pale, right? They become ischemic, and then they become infarction, myocardial infarction, yeah, and the cell died if don't get oxygen certain amount of time, like our brain, if don't get oxygen, I think around 6 to 10 minutes, depend on the percent, your brain will be vegetable, yeah, non-functioning. It's a dead brain. Okay, so they have a good mission. All right, they flow this blood into the lungs to go through gas exchange, which that's what the word, the definition of respiration. Yeah. So from right ventricle to pulmonary artery, we have this valve over here. So that's the valve here. What is that called? Valve? Pulmonary semilunar valve. Yeah, are we good? So that's the valve. Yeah, are we good? All right, so now the left ventricle. Oh wait, the fourth valve, if you guys can see this here. Can you guys see this? What color? What color? Maybe I wish they have more color. Over here. Can we see that over there? Yeah. Now, where is that between? Between the left ventricle, right? All of this left ventricle and aorta. Easy peasy, mac and cheesy, lemon squeezy, right ventricle and pulmonary artery, pulmonary valve. Left ventricle and aorta, aortic valve. Very easy. Just take the word pulmonary and aorta, right? So aortic, semilunar valve. Did I say these are, yeah? Yeah, Asian people are sometimes not so strong, especially Japanese. Have you ever heard say, yeah? Oh, Eric, we are Asian. It's hard to say R. Sometimes say L, right? So, okay. So aortic semilunar valve, yeah, over there. Eric say, yeah, ha, ha, ha. Like fried rice, we say fried rice. So yeah, we have to fight about that. I have so much accent, you can tell. One day I said that woman, but it's hard for Asian say th sound, right? I said that woman. What? Is there anybody died? Anybody died? Hero. Yeah. For Japanese, the L they sound R, but R they sound L. Yes, or Chinese. So I have that. We are struggling really to enunciate very well. Carmen, you have a great enunciation. I really want to learn from you. The way you say things, it's very, very intelligent. I enjoy that. Yeah. All right, anyway, now we already have all the four bedrooms, right? We're gonna emphasize this again with the song, rap song. Anybody like rap song here? Oh, good Spanish. Oh my goodness, Carmen, you don't have Spanish accent. Were you born here? You were. Okay, that's fine. Awesome. My niece, um, my husband's brothers, white, and the wife is Guatemalan. So she speaks fluently English and Spanish too. Yeah. All right. My sons would love to learn Spanish, not even Indonesian. I'm from Indonesia. All right. Anyway, Miss Kyla, focus. Okay, focus. All right. So where are we now? So we already have 4 chambers, and then we have that 4 doors, valves, right? Tricuspid, pulmonary semilunar valve, mitral bicuspid valve, right? And then we have aortic semilunar valve. Yeah, are we good? Are we good? Okay, and we already know that this pulmonary artery, right? And this aorta, this is ascending aorta, and it's gonna go down here, yeah? So if they ask you down here, that go also all the way to the abdominal aorta. So this is descending aorta, yeah? And then they go to all the way down abdominal aorta. So it's kind of like a big pipe, yeah? And then they're gonna branches to all over. It's just like a water district system. They have a huge big pipe from the main source, and then they're gonna branches smaller to the city, and then they get, oh, that's under city, to each of the maybe neighborhood, and then houses, they get smaller. So that concept, and then we get water, yeah? So that concept is similar with the circulation systems concept. So abdominal aorta here, yeah? So later on branches um, to the liver, to the kidney, yeah? And then innervate to the femoral, and then branches all the way down to our toes, okay? All right, so we got them all, that. Now, what is these 2 things? Anybody can tell me these 2 things. What is this and this? So we learn about aorta after we get the clean or oxygen-rich blood, and then we're gonna eject that through the aortic semilunar valve. Yeah, the heart, the ventricle is gonna contract like this, and then right, the blood is gonna be go to the aorta, and then all branches, right, and then that's how to vascularate all cells, trillion cells in our body, and that's what makes our body stay alive. Anybody knows when all of these aorta, arteries, arterioles, capillaries, vena cava, veins, venules, we combine them together, how far is that? How long is that? Anybody can tell? This is a fun fact. It's not fun fact. It's an amazing fact. Yeah. When we combine them all, anybody knows? Tell me how many miles? They said 60,000 miles. Roughly. Of course, nobody know for real. Now, what tells you this 60,000 miles? When you learn about Earth, right? The diameter, not even diameter, the all round of the Earth, right? From the 0 Greenwich to 360 degrees, that is 3,000 miles. So this 60,000 miles is like 2 times going around the globe of the Earth. Anybody's amazed here? I want to see your affection level. Sylvia, Eric, Christian, Isabel, Carmen, are you guys amazed? I'm not psychiatrist, yeah, so for your information. Yeah. Yeah, Isabel. All right, so you guys quite mentally healthy. That's good. Me too. I'm amazed. Amazing. But wait, there's more. That is like beyond comprehension. Out of these 60,000 miles, they are moving all the time, every 0.8 second. One cycle of the cardiac cycle is every 0.8 second, if you learn later. Yeah. If you do EKG from the P, beginning of P wave, QRS, T, and go back beginning of P again, that is 0.8 second. So this 60,000 miles journey of the blood happening in 0.8 second. Are we amazed? This is the cardiac cycle. I cannot comprehend it. But wait, there's more. Why? How do they do that? It's, yes, Carmen, I am wowing too. But the good part is, even the airplane, the fastest, or even the military airplane cannot reach that, going around the globe for 0.8 seconds. But here's the key, the secret, right? They have this blood vessel, but they have all millions branches, and they work together at the same time. Boop, 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 8 seconds. Yeah. So let's give a little bit perspective, guys, to appreciate our body system, huh? So say, let's see the blood vessels, 3-dimensional. Anybody's here when you cut any part of your body that's not bleeding? I just want to know if there's a bionic woman or man in here. Yeah. Anywhere you cut in your body is bleeding. So imagine like the head. This is even kind of simplification. You see that 3-dimensional, how much, yeah? You see that? You see that branches? And they work. So that's how they all together, 0.8 second, contract, right? And then go and then eject all over the body. And then, come on, guys, here your food, no nutrients, hormone that you need to live. We deliver that. The blood will say to all the cells. And after that, let's pick up your waste, trash, guys. And then we're gonna go back to the capillary. We're gonna get to the venules, and we go to the vein, and we're gonna back to the vena cava, superior, inferior, and we put the ductum into the right atrium. Yeah. So that is just amazing. Oh, well, some of them maybe not real. Yeah. So that's with some of your lymph nodes there. So it is just amazing. That is how the body, every 0.8 second, they can go one cycle. Yeah, so look at this. Yeah, look at that. That's why any part of our body, when we cut, it's gonna be bleeding. Yeah. If you want to try, you don't trust me, on your own risk, you don't sue me on that. Okay. Miss Carla tell us we gotta do hands-on training, cut part of our body to see whether it's bleeding, to prove the theory of this 3-dimensionality of the blood vessels. No, on your own risk. Okay. Or the bottom line is just trust that. Yeah, amazing. Oh, that's flower. That's looks like bacteria. Okay, so we go back to, where are we now? So now I don't know where I am. Oh, okay, I'm gonna close this now because we don't need that anymore. I'm gonna close this. Hey, we got our heart. Okay, are we good now? So we got all of this, right? So now my question is, after go feed, yeah, the whole body, and then come back taking the waste, and then anything other than waste coming from both arms and neck and the head, yeah, that will go to the inferior part of this biggest vein. What do you call? I'm gonna say yeah, what is that? Can anybody tell me? Yes, Carmen, good job. Inferior vena cava, superior vena cava. All right. Now we already, I think we got them all. Now, so we see that here, and then they put the blood into the right side of the heart that is poor oxygen, and they have a big mission to go to the lungs through the pulmonary artery. So this is pulmonary artery, yeah. This is left pulmonary artery. This is right pulmonary artery, right? Are we good? And then they go to the lungs. They go gas exchange, oxygen, carbon dioxide. We exhale carbon dioxide, we inhale oxygen, right? And then from the lungs, they go to the left. What is this? Let me just put it in here. Left atrium, right? This is right atrium. Right? So they go here, yeah, through all of these two things. You see that, these two things? If this is pulmonary artery, this is left pulmonary vein. Are we good? And then this is right pulmonary vein. So that's when from the lungs, go to the right pulmonary vein, left pulmonary vein, and it's kind of behind here. Eventually, there's a two hole here also, eventually get into right atrium, left atrium. Are we good? Yeah, so this is septum. Yeah. This is left ventricle. This is right ventricle. This is tricuspid valve, right? And this is the bicuspid valve. Or mitral valve, yeah. This is aortic. So it's good if you guys start print out these non-labeled, yeah, semilunar valve, right? So we pretty much have everything. So this is pulmonary semilunar. This is you guys, valve. Yeah. And this is foramen ovale. Yeah. This is the one that when you're baby, that's kind of open up because they don't have a complete four chamber system at that time. Yeah, because it's all from the mother and eventually they're closed. So, and then this is, oh, never mind. This is the tricuspid valve. Oh. Sorry guys, so if you guys can print out and then make a note on your own, or if you have Apple with the pencil, you can get that and write that down and save it. Yeah. So I need to change this. This is okay. So this is the tricuspid valve, right? Now, anybody know what is this? It's kind of like a thread, and then we have muscle here. Yeah. So when people have that problem with their valve, which is very common, like mitral valve prolapse, mitral valve stenosis, yeah, especially people with the Down syndrome, they're prone to have that problem. So what happened, so you see that in order to open close this valve door, we have something kind of like thread here. So when this muscle contract, right, they become smaller. It's going to pull this, right? Okay. When this is relaxing, it's going to kind of relaxing this. That's when happening closing and opening of the valve. Anybody knows what is this? And adding with this, what is this? And we know there's something down here also of the aorta, right? Descending aorta. Anybody knows this? It's a two-word. Start with C and T. Maybe I have to put down there. It's like a cord. So the way you remember is chorda. It's like a cord, yeah? Tendinae, yeah? And then this is the muscle one. It's quite similar in the eyes. There's a ciliaris muscle, quite similar with that concept. When our pupil get mydriatic and myotic. So there's a cord kind of pull, yeah, and relaxing. So this is what called papillaris muscle. Yeah, we need muscle to to contract and relax. Okay, so I guess we get everything already, right? All right, any question so far? We're gonna watch the rap music after this, but guess what, it's 10:20. Let's take a break, so our brain a little bit relaxing, because our brain is too much contract, and then our glabella kind of start doing like this, and then we become numb with our affection. We cannot really smile because our brain is working so hard, busy just concentrate to memorize this part, and we lose our balance in life. Yeah, we want to be healthy, spiritually, mentally, socially, financially, academically, all dimensionality. All right. Okay. Let's take a break, because this is a good number, 10:20. We never remember the odd number. Let's come back at 10:40, okay? And then we have another 40 minutes. All right, guys. All right, bye.